Hi. Okay, I want to wrap up this lecture with diabetes. It's the last thing that we have. It's the last thing that we have to discuss in the endocrine system. Now, I do want to begin by telling you that normal blood glucose levels are between 70 and 110. Now, there are two types of diabetes: diabetes 1 and diabetes 2. Let's talk about diabetes 1 first. It's usually noticed in childhood and can be recognized maybe the first time by diabetic ketoacidosis, DKA, and it has a very abrupt onset. Now, diabetics with type 1 usually have little or no insulin. Now, as you know, cells require glucose. Glucose cannot make it to the cells by itself. Therefore, our pancreas makes insulin and it carries the glucose to the cell. Now, if you are ingesting glucose but not making insulin, that glucose cannot get to your cells. Therefore, it begins to build in the vascular space. Now, glucose is very hypertonic, meaning that vascular space is going to be packed with particles, glucose particles. Not only that, since it's hypertonic, it will be pulling fluid in. Okay? Now, your kidneys are going to react to this by trying to get rid of that excess volume. Okay? So, your kidneys are going to begin to diurese. You cannot just go sit on the toilet and poof, out some particles, can you? No, those particles are excreted through the urine. You're going to begin to diurese, okay? But in the meantime, your cells still have not gotten what they needed. So therefore, they will begin to break down fats and proteins. Now, you know, the breakdown of fat releases ketones, and ketones are acids. Those acids begin to build, and now you have metabolic acidosis. And this is when type 1 is usually found. Now, I do want to tell you some symptoms for this hyperglycemia, and it's thought of with the 3 P's, okay? The polyuria, polydipsia, and polyphagia. Now, the polyuria is due to the packed particles being released in the urine. You are excreting large amounts of urine, okay? Which, you're thirsty now. That's where the polydipsia comes in. Extreme thirst. Extreme urination, extreme thirst. Now, your cells still have not received the glucose. So you have that hunger going on, thinking that you're still hungry, needing those glucose, okay? That's the polyphagia, extreme hunger. 3 P's, the polyuria, polydipsia, and polyphagia. Now, I want to let you know that these patients have to have insulin. These oral hypoglycemics are not going to work with this person, okay? They have to have insulin. Their body is not making enough or has none at all. Now, let's talk about type 2 diabetes. Usually, these clients don't have enough insulin for the glucose that they're taking in, okay? Now, the pancreas is still working, so you won't see that metabolic acidosis where you see the breakdown of the fats and the ketosis and the acidosis, because you are still using some insulin and glucose, but it's just not enough because the person is taking in too much glucose for the amount of insulin that they're producing. Most people with type 2 diabetes are going to be overweight, okay? It's usually not as abrupt as number 1, type 1, and it's usually found by accident. Maybe they have a wound that won't heal. Now, repeated vaginal infections are also a sign. Bacteria loves to live in that sugary environment, and they thrive. So they do really well in that sugary environment, and that's really the problem here. Now, individuals with type 2 diabetes really need to be tested for what's called a metabolic syndrome. And this metabolic syndrome is actually just a group of risk factors that occur together that increase your risks for diabetes and coronary artery disease, okay? Now, this includes like insulin resistance, obesity, an increased triglyceride level, a decreased HDL, increased blood pressure, and coronary artery disease. Now, for type 2 diabetics, we should first really, as far as treatment goes, start with diet and exercise. As you know, diet helps when you encourage the person to quit eating as many carbohydrates. Okay? Now, with exercise actually reduces your glycemic level. So, if we can get a type 2 diabetic to really focus in on what they're eating to try to keep their glucose level in a range where their insulin can help, it might solve their problem. If not, we might try oral agents. They might have to take insulin though. But for the most part with type 2 diabetes, the people taking insulin is due to the fact that they're really not compliant with the diet and the exercise. Now, gestational diabetes is and resembles type 2 diabetes. The main thing with that is that the pregnant woman needs 2 to 3 times more insulin than when she's not pregnant. If your body does not adjust to this, then therefore you do have too much glucose. This screening is usually done around 24 to 28 weeks. 24 to 28 weeks gestation. Complications with the baby is an increased birth weight and hypoglycemia. Now the hypoglycemia is due to the fact that the whole time this baby has been getting all the sugars from the mama. And so the baby's insulin has been really pumped up. But now all of a sudden the baby's not getting the mama's sugars. But the insulin is still popped up. Okay? Which leads to hypoglycemia. Now, just general treatment overall for type 1 and type 2 diabetes, okay? The majority of your calories should come from complex carbohydrates. 55 to 60% should come from complex. Now these are going to be digested more slowly in your body and not have such wide variations in your glycemia at certain times. They're digested slower. Now, 20 to 30% should come from fats and 12 to 20% from protein. Now, this is normally because most diabetic patients have renal problems. And as you know, the kidneys cannot handle a lot of protein, right? It creates even further problems. That's why the majority of calories should come from the complex carbs and the fats instead of protein, as you would think that it should. Now, diabetics are prone to coronary artery disease because that high sugar affects those vessels just like high fat. It does as much damage to those vessels as, say, a high fat diet would. Now, we are going to suggest and hope that the diabetic increases fiber in their diet, because fiber actually slows down the absorption of glucose in the intestines. So that slowed down absorption causes spikes and great variations in that blood sugar. And that's what causes vascular damage. exercise, okay? Now, it's very important that you teach the diabetic to exercise the same time and the same amount every day. Exercise is very important for helping maintain that glucose level, and also regularity is important here. Now, you should eat before you go because exercise lowers the glucose level, for one. Two, your glucose level needs to be stabilized before you start. Now, so before you exercise, please remember to eat something. Exercise when your blood glucose is at its highest, because it's going to come down. Now, oral hypoglycemic agents actually stimulate the pancreas to make more insulin. Okay, so the oral hypoglycemic agents actually go in and kind of pump up that pancreas. Make some more insulin, please. Okay? Now, oral anti-diabetic agents like Guctrol and metformin, okay, and Actose, they're really only given to type 2 diabetics. Now, insulin. We all know about the insulin, okay, and I said that type 1 diabetics have to have insulin, and some type 2, mainly non-compliant diabetics, might have to have insulin, okay? So this dose is actually increased until the blood sugar regulates and is normal. And there are no ketones and there are no glucose particles in your urine. That's how you know how much insulin, okay? Now, we have regular insulin, which is clear. It is the only insulin that can be given IV, is regular insulin. Now, we also have Lantus. It's a long-acting insulin, and it is also clear. But you can't mix Lantus with anything else, okay? Now, we have a cloudy insulin, NPH. NPH insulin is cloudy. So, if you're drawing up insulin and you're giving regular insulin and NPH insulin, I want you to remember, you go from being clear, you draw the clear up first, to cloudy, okay? Clear to cloudy. It's a beautiful day, you're at the park, you packed a lunch because it's clear, and now it's cloudy. Clear first, then cloudy, okay? Now, I want to tell you about HbA1c, glycosylated hemoglobin. This is a blood test. When we ask you, what's your blood sugar been running, and you try to tell a little fib, we can do this HbA1c test and actually test your blood sugar over the past 3 months. We really want your blood sugar test to come back between 4 and 6%, okay? That would be our optimal range there. Now, you should eat when insulin is at its peak, okay? That's when it's going to be most effective. That's why you learn the onset and the peak times and the duration times. You need to go back and refamiliarize yourself with those. Now, when you are stressed or sick, okay, your blood sugar goes up, which means you will need more insulin. If you are in the hospital, if you had surgery, if you are extremely stressed, keep a watch on your glucose level. We do not want you slipping into a diabetic coma, okay? Illness equals DKA. The normal pancreas can handle these fluctuations, but when you are diabetic, the pancreas is not up to par, is it? Now, when giving insulin, you need to rotate spots in the area first. Then, after all that area has been used up, move to another area, okay? You need to let your original area heal 3 to 6 weeks. You know you don't aspirate sub-Q, okay? You do aspirate IM injections. You pull back, make sure you're in the muscle, not in the blood vessel, right? But with sub-Q, you don't aspirate. It causes too much tissue damage. Now, the insulin pump is an alternative to doing shots every day. And what it does is it just mainly gives you just little insulin all day as you need it, okay? It helps you maintain a better control. And also when you have meals, it gives you a little extra. Now, I always remember, cold and clammy needs some candy, okay? Now, hypoglycemic and hyperglycemic episodes. The signs and symptoms of hypoglycemia, not enough. Cold and clammy need some candy. You bottom out and you lose brain cells, okay? If you walk in to somebody's room and they are diabetic and they are passed out, assume they are hypoglycemic, because that is the most important thing, because they are losing brain cells, right? Your brain has to have a constant supply of glucose. Now, cold, clammy, confused, shaky, headache, nervous, nauseous, increased pulse, those are all signs and symptoms of hypoglycemia. Now, first, you need to eat a simple, fast-acting, simple sugar to get it on up there. But it's not going to last long, so you need to come behind it with a complex carb that's going to stick with you. Complex carb and protein is going to help keep it up, okay? Now, after the sugar is up, you should give the complex carb and protein like peanut butter crackers. Also, when you go into that patient's room and you're assuming the worst and you're assuming hypoglycemia, you are going to run out and you are going to get the D5, D50W and you are going to put it in their IV and you are going to push and push and push and push because it's so hard to push. Now, after that, follow up with the complex carb. If they don't have IV access, it's going to be injectable glucagon, which is also known as glucagon. Okay? It's given IM when they have no IV access. Okay? The main thing is to try to prevent the hypoglycemia. Eat. Check your insulin. And snack in between meals. Now, complications of diabetes, especially with type 1 is going to be DKA. That diabetic ketoacidosis, okay? Now, anything that increases your blood sugar can throw a client in diabetic ketoacidosis. Illness, stress, skipping your insulin, okay? Infection. If you are sick or stressed, watch that glucose level. Like I told you earlier, DKA might be the first sign of diabetes. And you have all the same signs and symptoms of type 1 diabetes with DKA. Now, what happens is that absent or inadequate insulin causes the blood sugar to go sky high. You have your 3-phase, the polyuria, the polydipsia, the polyphagia, right? That acid begins to build up. So your lungs come in, try to get rid of acid by blowing off CO2. So the diabetic will actually have Kussmaul's respirations. Now, the first treatment is that you've got to get the insulin levels under control. And you need to treat whatever it is that's causing the insulin to be so high. The glucose to be so high. Now, you need to be doing hourly blood glucose and potassium checks because remember, insulin puts glucose in the cell and moves potassium out of the vascular space into the cell. So be watching for hypoglycemia and hypokalemia. You're going to have to keep them hooked up to the EKG because of the potassium issue. Hourly outputs. This is important. Polyphagia, polyuria, polydipsia. Okay? They are putting out so much urine, they might have actually gone into the alburia stage by now. ABGs, we got to watch for that metabolic acidosis, don't we? Now, they're going to have IV fluids, and you're going to start with normal saline. Isotonic, it stays in the vascular space, right? When the blood sugar gets down to about 300, that next little tiny drop could cause them to become hyperglycemic, right? Hypoglycemic. Hypo. That next little drop could cause them to become hypo. So at this point, we're going to put them on D5W to prevent that hypoglycemia. Anticipate that you will see some potassium added in there at some point, right? Because what is that insulin doing? It's putting potassium into the cells also. Now, one last thing I want to talk to you about concerning diabetes is the hyperosmolar hyperglycemic non-ketosis. Now, this is the sister for DKA, and this occurs with the type 2 diabetics. It looks just like the DKA, except for there is no acidosis. Why is there no acidosis? Because you still are producing enough insulin to cause the breakdown of fats and ketones not to happen. Excuse me. Now, no fat breakdown, no ketones, no acidosis. Is this client going to have the Kussmaul's respirations? No. So, I want you to think type 1 DKA, type 2 HHNK, hyperosmotic, hyperglycemic, non-ketosis, okay? Vascular problems with the diabetic are going to be a big deal. The more controlled their diabetes stays contained and in check, the less problems that they're going to have. But that sugar does irritate the vessel linings. Accumulation of sugar decreases the size of the vessel lumen and decreases blood flow. Now you know, anytime we have decreased blood flow is a bad situation. If it's decreased to our eyes, we can have diabetic retinopathy, which can lead to blindness. Nephropathy. I hate thinking about my kidneys not getting enough blood flow, okay? You might end up on dialysis because of that. Neuropathy, okay? Now this is where the lower limbs might not get perfused enough. Foot and leg problems, tingling and pain down there. Sexual problems, impotence may occur because of a decreased blood flow, decreased sensation. Diabetics really need to take care of their feet, okay? They need to file their toenails straight across. Every single day, those feet need to be inspected with a mirror or your friend or whoever, if you can't see them yourself. Any sore needs to be taken care of immediately. Your shoes need to be well-fitting, no tight-fitting stuff. This is going to cause problems in your feet. Always wear shoes. Never go barefoot. Avoid any harsh chemicals. And what else? Dry your feet completely. Bacteria love to live in warm, moist areas. And as you know, diabetics have an increased risk due to the fact that so much glucose, the bacteria love to live there anyway. Okay? Now, A neurogenic bladder is just where your bladder does not empty properly. It may empty spontaneously, like incontinence, or may not empty at all, like retention, which is another problem, okay? Gastroparesis is where your stomach contents are delayed from emptying. That increases your risk of aspiration when you lay down, right? Also monitor, like I said, for the increased risk of infection. Thank you for your time concerning the endocrine system. Endocrine has always intimidated me, and there's just so much to know, but the more and more you go over it, the better you feel about it. Thank you so much.